Okay, so what's next? Evidence of a belief in the possibility of psychological change. So, this is about having conviction in psychological therapy and psychological models, and that we as psychologists can do things to help people and influence change. I'm not going to labor on about that one too much because I think I'm preaching to the converted there. Next one is evidence of respect for fairness and diversity. So yes, this one relates very, very closely to our equality and diversity core skill or soft skill. And this is about understanding, as I said before, the impact of difference um, on the way that we access services or the way that people access services, and therefore how much people are able to benefit from those services. It's not enough that somebody has not come to us. Why haven't they come to us, and are there barriers to them coming to us, and should we be doing more to try and help them to access us, or should we be trying to go to them? These are important things to think about, in terms of being able to provide an equitable service, and thinking about our own value bases and impact upon our work. Are we curious about our own backgrounds and other people's backgrounds and how they differ? Are we curious about what we don't know about people and how may have influenced our lives essentially? And is it important for us to unpick some of that and to name some of that in the therapy room, or even if it's with a colleague, to name some of those differences so that we can work through them? What is your motivation to learn? What is your motivation to do that? That motivation needs to be demonstrated via the situational judgment test, that motivation to understand what's going on for people in terms of equality and diversity. Okay, next one, capacity for frequent extended periods of intense concentration in a range of clinical contexts. For example, individual or group therapy, clinical assessments, interviews, clinical supervision, which require active participation, which takes account of dynamic processes and where planning of appropriate responses to these dynamic processes is required. So this is about being able to sustain attention for long periods of time, or put things into place so that you can sustain attention and concentration for long periods of time. It might be about you being aware of your own energy levels and asking for planning in breaks to make sure that everybody can stay concentrated um, and sustain attention. But are you aware of what your attention span is, and are you thinking about that beforehand? Um, what can you do to kind of make yourself most comfortable, um, so that you can sustain attention for a long time? Okay, next one, potential to work effectively under pressure, including working directly with staff and clients who may be highly distressed, analyze data where there may be frequent interruptions, prioritize work, operate a waiting list, meet short deadlines, and function within an unpredictable work pattern which requires regular revision of plans. Yeah, tell me about it. And actually, it's really difficult for me to be setting up my calendar weeks and weeks in advance because there's no point. I'll end up doing my calendar 3 or 4 times, changing things around. We are constantly working under pressure. And this comes back to, again, being adaptable and flexible. Are we able to manage our own feelings, our own needs around change and around the unknown, so that we're able to adapt what we're doing, adapt our plans, and reprioritize and make sure that things are ticking over, that the service is working, flowing, and everybody's being seen. Are we able to do that? Are we able to work under pressure and manage that stress so that we're able to deliver? Ability with appropriate support, so that means maybe with supervision, to undertake psychological assessment and therapy in an emotionally demanding environment with frequent exposure to highly distressing or highly emotional circumstances, including situations where sexual abuse, family violence, and breakdown, mental illness, or terminal ill health may be the focus of the psychological intervention. Yeah, so it's tough, and we do deal with really difficult themes, but this is the thing about working safely and ethically and going through training. We are, very much, this is very much a focus for us, working in a way that we can sustain this essentially. Are we able to kind of develop a resilience and a capacity to recognize when things are becoming overwhelming, when things are feeling really, really hard? That's really, really important. Okay, yes, we need to be able to do all of this work. But we also need to be able to identify when we're finding things overwhelming and be able to check in with people to get that appropriate support that it's talking about there. We need to be thinking about our own fitness to practice. When is that compromised? And really, really taking steps to manage that risk. Um, being open about it and taking steps to manage that the best that we possibly can, so that we can get back into our full work pattern again. Ethical issues in terms of making sure that people are fully informed in terms of what therapies or interventions they might be receiving, and giving them the option to say no. Sometimes families really, really want their loved ones to have a dementia assessment, but at the end of the day, they haven't had a dementia assessment yet, and they don't have to have one. It's up to them if they want to have one. So really taking on board what that person is saying and understanding that if they have the capacity to say no, that we have to respect that people have the option to make unwise decisions if they don't impact or influence anyone else or don't raise a safeguarding issue. But then there is also, understanding what safeguarding is and knowing that that trumps pretty much everything else. So really thinking about situations where ethics is tricky, or upholding ethical practice is feels like it's a conflicting thing within us. But knowing that safeguarding policies, that we have kind of Mental Health Capacity Act in place, we have Human Rights Act in place, we have GDPR in place. All of these policies and procedures and laws help us to operate and act and practice safe and ethical. Another really important ethical dilemma that we have as trainee clinical psychologists and as clinical psychologists is the idea of power and power imbalance. It's a really interesting position to be in as a trainee clinical psychologist, because on the one hand, you have a whole heap of power, particularly when it comes to working with clients. You as a trainee clinical psychologist will get very much clued up on things in a way that you probably wouldn't know and appreciate, but definitely clued up on mental health and knowing a lot more about mental health than the average person, probably because you spent so long working on it. But then when we're with supervisors or with team leads or just other senior members of staff, we can feel very disempowered and disenfranchised, and that can be quite a tricky balance to strike, and it can be tricky to know where we stand as training clinical psychologists when we're in the middle of training, because of that power tussle, and being in a different, slightly different role, depending on who you're around, can really influence the type of power we have. And so being aware of that and the power that we do have with clients particularly is really important to communicate as part of the situational judgment test. Ability to function well in context of unexpected or uncertain outcome, in the absence of guidelines in novel situations, and to gain and to contain anxiety and distress on behalf of others, including other staff within the organisation. So this often happens when there was change. I can think of a very, very recent time where there's been a lot of change. This virus called COVID changed our entire way of working, and it was a very anxiety-provoking time. But think back to how you coped with that. What helped you? What helped you to manage that change with in the work and work pattern, and holding those things in mind when doing the situational judgment test. As clinical psychologists, we're often the ones who are able to take a step back and to understand what people might be going through, or formulate what people might be going through, and help other people to understand how that they might be feeling. And so as clinical psychologists, it's really important that we're able to manage our feelings, manage our expectations, and hold for people hope that things are going to be okay, and I guess do some of that thinking work that you can only do when you're feeling more relaxed and less anxious, because other people naturally might feel more anxious. Evidence of potential ability to work as a lone worker in circumstances where there may be exposure to severe distress, verbal or physical aggression. So this is not to say that you should be standing in harm's way. You should not. This is to say that we should be thinking about potential risks before we go into situations, and as we are in situations, dynamically risking all the time to keep ourselves safe. So are you doing that? Are you keeping an eye out for, I don't know, a fire hazard or a trip hazard? Are you taking into consideration the way that people's facial expressions might be changing? Or if they're going quiet, are you questioning why they're going quiet? Are you keeping yourself safe? It's very, very important that in a situational judgment test, you are keeping at the forefront of your mind safety and safeguarding. But also thinking about, lone worker policies and working safely as a lone worker. So if we can just quickly have a look at the lone worker framework. Lone workers are those who work by themselves without close or direct supervision. And as trainee clinical psychologists, you will often find yourself as a lone worker. Lone workers can be people working in the same premises, but they're working in different rooms. So if you're working as a trainee clinical psychologist and you've taken someone to a clinic room to do a session, technically you're a lone worker there. Working out of hours, so if you find yourself working slightly later than most people, you're a lone worker. If you're a ward-based staff member and you want to take someone outside for a quick break or a quick cigarette or something like that, you're a lone worker. And of course, working in the community, going and seeing people in their homes, you're a lone worker. So it's important that you are thinking about lone worker policy and keeping yourself safe as a lone worker. And that involves, as I was saying before, you preparing yourself. So you're going to that meeting, knowing what you're going there for. You've done a risk assessment. You've looked at their notes. You've got a system in place where somebody from your team is going to check in with you. They know where you're going, the address, your telephone number, and they can check in with you if you're late back or if you uh, if they just need to get hold of you or you can get hold of them. Have you made sure that your phone charged and that you know your route home and that you know your route there? And of course, doing a dynamic risk assessment while you're in that space as well. So, feeling confident enough to say when you walk into someone's house to say, actually, that there, it's a bit of a fire hazard. Would you mind if I move that? And really thinking about, if they say no, you can't remove it, they're really thinking about whether it's safe or not for you to be there, and perhaps you maybe need to think about going. So that's a little bit about lone working. So how many do we have left? Oh, we just have one more. Evidence of potential ability to work effectively whilst exposed to unpleasant working conditions, including frequent exposure to verbal aggression and occasional exposure to physical aggression. Yeah, so again, this is about, keeping yourself safe. So doing your trainings and making sure you're up to date with kind of de-escalation trainings and knowing how to identify when people might be getting upset, and when responding to that with kind of de-escalation techniques like acknowledging people's feelings and validating their feelings and just aligning yourself with them so that they know that you're on board, to help. So those are the trainee clinical psychologist person specification points that I wanted to cover with you.